Tony and Melissa in the morning on WICC 600. Sponsored by Selco Heating and Air Conditioning.
All right, good morning. We're at 7:08. We've got 43 degrees. This morning we welcome Dr. Fred Browne from Griffin Health. He's here, and he's with us every Monday at this time. A very, very helpful source during the whole coronavirus thing. Dr. Browne, welcome, sir. How are you today?
I'm very good. Good morning, everyone.
All right. So glad you're here. Griffin Health has now set up a COVID-19 testing site. We know people need to make an appointment before showing up. What else do people need to know? And what are you finding at Griffin with the outbreak so far?
Absolutely. So right now we do have a testing site. It's been up for a little over a week. We're seeing about 35 patients a day. The only way that we're actually doing those, it needs to be scheduled. And we need to have there needs to be an order from a physician. So both of those need to be done. We are seeing an increase in the community as expected. I mean, you keep hearing this on the news, so that this is actually the case. We're seeing about 10% of the testing that we're doing is positive at this point. Most of them are community-based, and again, going through our drive-through testing.
Dr. Browne, are you finding, now that you have a testing site on campus for you guys, are you finding that it's kind of taking nurses out of commission a little bit to now handle the testing?
No, we actually have a lot of volunteers. We've been able to train techs and students and other people to do this testing. So we're still able to keep our full complement of nurses in the hospital, and then our backup nurses, if things get worse. So we've actually used our School of Allied Health and other members to help us do the swabbing.
Okay, we're speaking this morning to Dr. Fred Browne from Griffin Health. Dr. Browne, we know 211 has been pushed by the state if anyone has questions about COVID-19, but Griffin also has a health line, or a hotline, I should say, for people. Can you tell us what that's all about?
Absolutely. So obviously we get a lot of calls. We get a lot of calls and a lot of questions. We have a question and answer list for our volunteers that are manning the hotline. So if anyone wants to call, I'm sure you guys have that on the website to give any of the people in our community any questions they have about COVID-19, questions about testing, questions about sort of our expectations over the next several weeks to months.
So, Dr. Browne, do you have that number? Not to put you on the spot, but if you don't,
put me on the spot.
Okay, no worries, because I think I may have it right here actually. So it looks like the Griffin Health hotline is 203-204-1053. Does that sound accurate?
That is correct.
Okay,
yeah.
great.
I also have the testing site appointment number.
Oh, good. Yeah, please give that to us.
203-437-6815.
Okay, great. So that's the testing site number is 203-437-6815. But the Griffin
Correct.
Health hotline, if people have any questions, they want to know when you're available and all that, that's 203-204-1053.
That's correct. And the only way you'd want to make that schedule, and remember, we need to have a physician that actually writes an order before we can actually schedule anything.
Sure. And for Griffin Health caregivers, when are you guys available to answer those questions if people call through the hotline?
Currently, we are available 8 to 5 during the weekday and 8 a.m. to 3 p.m. on the weekends.
Okay. All right. Good to know. So how can the community help Griffin Health workers? We know that the governor has been pushing for medical equipment, things like ventilators, the N95 masks, to be donated. How can people help out Griffin specifically?
That's also a great question. I don't think anybody can donate ventilators unless people have them sitting at their house, which I doubt. However, we could use masks. Paper masks are great. N95, KN95s, which are European make, are also helpful, and gloves are really in need. As you can imagine, as we continue to see more of this in the community, every time that a patient comes in or needs to be ruled out for this, we go through quite a bit of PPE.
We know this has been, it's a difficult time for everybody, but we know that you and your staff have been working very, very hard. How are you and the staff holding up there at Griffin?
I think we're doing well. We have a very dedicated staff at Griffin Hospital. I got to tell you, I'm very proud of them, the doctors, the nurses, the techs, the staff. You remember, it's still, we still have to run a hospital, so we still have to have dietary, we still have to clean. So everyone still is in really good spirits. I mean, I can tell you that people are getting tired. This does take a lot of effort, even potentially ruling out. So those who are presumptive and then end up becoming negative, it still takes a lot of effort. So I can tell you that our staff is holding up well. It's a great team at Griffin.
All right. Dr. Browne, thank you so much for taking a few minutes. We're going to say a prayer for you and your staff over there and all medical workers, people who are on the front lines. They're all doing a great job. I don't know what we would do without folks like you. Thank you so much.
Thank you, Melissa and Tony. Appreciate it.
You got it. It's 7:14 here at WICC 600. Traffic and weather is next.